It is a shared program between the federal government and the state government. So we're both putting dollars into this program. And what the bulk of this shared savings plan is that we are simply running it, according to the actuarial tables and the trend lines, better than other states are. So it is costing less federal money for our program. We've not been able to take advantage of that in years past. We've just put the $4 billion plus into the program. We now can use that money, those savings that are already there, with no reduction in benefits, no reduction in services, and in fact increases in those as those shared savings continue to come in, if we don't change anything about the way the TennCare program is being run right now.
In discussion for 20 years. I sat on the TennCare subcommittee. We literally sat through multiple presentations. This Medicaid shared savings program has gone through 16 different committee hearings since February of 2019. There is no doubt there are times down here we rush a process. But I can assure you, and I can assure the Tennesseans that are watching right now, this is not one of them. Our Medicaid program is considered one of the top 5 programs in the nation. One of the top 5. We lead the nation in limiting the growth of state dollars required to operate the program. Our annual trends are well below state averages. We have a member satisfaction rate of 90%. We're recognized as a leader from our level of access by our providers. We're delivery innovators in system reforms and LTTS and all these other acronyms that I don't even know what they mean. We also recently received 2 national awards regarding our TEDS implementation. So we have one of the best run Medicaid programs in the country. And let's be really transparent too. We are the most fiscally stable state in the nation. We are considered by most publications one of the top 3 run states in the nation in most categories.
CMS calculates the maximum amount that they believe that it should cost us to run our Medicaid program. Tennessee has consistently come under that budget neutrality cap, saving the federal government billions of dollars. What this waiver allows is for Tennessee to recoup up to 55% of those savings and reinvest it into the health of Tennesseans. This would not cut provider rates, and they are on the record in committee saying that they would not cut provider rates. The demonstration requires TennCare to meet certain quality metrics, and that's on page 6 of that letter. TennCare has agreed that if there were any rate reductions to providers, they would not be able to meet those quality metrics. This waiver does not allow for cuts in coverage or decrease in benefits. On page 5 of that 16-page letter, it clearly states any coverage or benefit changes to existing populations covered are limited to those that are additive in nature, and the state is not authorized to make reductions in its current approved coverage or benefits package without approval of another amendment.
There's a reason that Tennessee has this opportunity, a unique opportunity, and that's because we have proven that we can manage our dollars well. We've proven that throughout the state government, not just with TennCare, but other states might have sought this sort of deal, but they know they're not going to get it because they don't have the proven track record that Tennessee does. That's why we're able to negotiate the flexibility in spending. That flexibility is going to allow us to put TennCare dollars, federal dollars, where they need to be in the state. Not where the federal government thinks they need to be, but where we know that they need to be. As a Republican, as a Tennessean, as a conservative, as a total fiscal conservative, my belief is money is best managed closest to the people.
There is another benefit that has come across, and that is we have savings. Fair is fair. If it is savings, we should be able to save them and use them for other purposes. We should not be sending all of them back to the federal government. This is what this waiver does. It allows us to keep part of those savings, the savings that we generated from good policies. It allows us to keep them and use them for better means and better use. And I don't have any doubt that we will be able to do that better. Other states are not doing it because they don't have the savings that we have been able to achieve.
I am incredibly passionate about DIDS, our developmentally disabled. We have over 4,000 people on a waiting list right now that are eligible for services. This will allow us the flexibility to begin to move people off that waiting list onto the active roles for getting services that they need and they deserve. They are truly the least of us. Those are the folks that we are called to care for. This grant will provide for us as the Tennessee legislature the ability to serve our citizens better. That's what we're elected to do. That's why we're here. And I urge you all to support it. Believe in us. We have the track record. We've shown that we can do it.